Hi, good evening all. I'm Dr. Sumana, consultant gynecologist, Lotus Hospitals. Today I want to discuss regarding cancer cervix. What is cancer cervix? Cancer is abnormal growth of the cells of cervix. Uterus opening is called cervix. Abnormal growth of the cervical cells are called as cancer cervix. Usually, HPV viral infection causes cervical cancer. Type 16 and 18 are more probable causes of cervical cancer. What are the risk agents for the cervical cancer? HPV infections, sex at younger age, smoking, multiple sexual partners, weak immunity are the probable causes of HPV infection or cervical cancer. What are the risk factors for cancer cervix? The weak immune system, smoking, having many sex partners, starting sex at younger age, birth control pills, sexually transmitted diseases like HIV, chlamydia, gonorrhea, syphilis and HPV infections. Now, how it presents? Usually cervical cancer, earlier stages it may present as genital warts at the beginning stage and foul-smelling vaginal discharge, the vaginal bleeding, especially after the intercourse, or irregular vaginal bleeding or bleeding during sex, painful intercourse, or it may present as pelvic pain, urinating problems and defecating problems. And after the genital warts, usually if the preventive measures are not taken properly, it may progress into cervical cancer. So what are the preventive measures for cancer cervix? HPV vaccination and avoiding multiple sexual partners, avoid smoking and use condoms during sex. The preventive measure is a cervical vaccine, that is Cervarix and Gardasil. Cervarix vaccine is available as 3 doses that can be given in 0 months, 1 month and after 6 months. Whereas Gardasil vaccine, it can be given in 0 months, 2 months and after 6 months. This vaccine can be given to 14 to 26 years age group women. Cancer cervix, how it is diagnosed? It can be diagnosed by the Pap smear or Pap smear, colposcopy directed biopsy, ultrasound abdomen and pelvis, CT scan and MRI pelvis. What is Pap smear? Pap smear with a spatula will scrape the cervical cells and it is examined under microscope. The results will show whether the cervix is having an inflammation or infection or any malignant changes. When Pap smear is showing abnormal changes, this smear is directed to the colposcopy directed biopsy. CT scan and MRI also gives information regarding the cancer cervix and lymph node involvement. What are the treatment modalities available for the cancer cervix? If the cancer cervix is a stage 1, there is a radical hysterectomy along with lymph node dissection is the available treatment. If stage 2 and stage 3, chemotherapy and radiotherapy are the treatment of choice along with the radical hysterectomy. So, be safe, protect from the cancer cervix. Prevention is better than cure. Take a Cervarix vaccine and get annual health checkups done every yearly with the Pap smear. Thank you.